Welcome back to AI Analysis. I'm Stanley, and like always, we have got some really cool research to dig into today. Make sure you check the description for links to all the full articles if you want to go deeper on your own. Today, we're looking at the Lancet from March 30th, 2024. Issue number 10433, and let me tell you, it is packed with insights.
Oh, it's always a treat to see what the Lancet has curated. Yeah, this issue is no exception. It covers such a diverse range of topics that really highlight how interconnected health, science, and society truly are.
I couldn't agree more. Okay, so first up, we're diving into a study that tackles a challenge a lot of people might not even know exists: the link between epilepsy and mental health in kids.
Yeah, this is a crucial area of study, and this research really shines a light on the fact that children with epilepsy often face mental health difficulties, things like anxiety and depression, at a much higher rate than kids without epilepsy.
It really makes you think, is it the epilepsy itself? Or is it like the stress and the social stigma that goes along with it? I imagine it's incredibly tough on both the child and the family.
Oh, absolutely. It's a very, very complex situation. And this study highlights yet another layer of complexity. Accessing proper mental health support for these children, that can be a real nightmare. Imagine trying to navigate a complicated healthcare system, juggling appointments with different specialists, trying to find the right therapy for your child. It can be so overwhelming.
So this study doesn't just point out the problem, it actually offers a potential solution, right? Tell me about this MICE program.
MIC stands for Mental Health Intervention for Children with Epilepsy. And the study's findings are actually really encouraging. They found that integrating mental health support directly into the existing epilepsy care team, rather than sending families off to another specialist, that made a big difference.
So instead of sending these families on a wild goose chase, you're bringing
Yes,
the support right to them.
exactly.
That sounds so much more helpful.
And here's the truly fascinating part. The therapists delivering the MICE program weren't all highly specialized child psychologists. Some were epilepsy nurses or other professionals who received training on this specific approach.
Oh, wow.
Yeah. So this suggests that we could reach even more kids in need if we empower the healthcare providers that are already there.
I love that. It's a great reminder that sometimes the best solutions aren't about creating something totally new. It's about using what we already have, but in a smarter way.
Couldn't have said it better myself. It's about creating a more holistic and integrated approach to care, recognizing that physical and mental health are so deeply intertwined, especially for kids facing these chronic conditions.
Okay, time for a total change of scenery. Let's talk rare kidney diseases, something that most people probably don't think about that often. This next study involved a massive amount of data, didn't it?
Well, you bet it did. They used something called the Radar Registry, which is this UK database. It's filled with info on just a staggering number of patients, all with rare kidney diseases. We're talking 39 different disease groups, data from 108 clinics across the UK. And get this, records going all the way back to 2010.
That is a lot of data. But why is this registry so important? What can it actually tell us about these rare conditions?
Think of it like a treasure map, Stanley. Each piece of data in this registry is a clue, helping researchers navigate this really complex world of rare kidney diseases. By analyzing data from thousands of patients over many years, they can start to put the pieces of the puzzle together, uncover these hidden patterns, and that can lead to breakthroughs in diagnosis, treatment, and maybe even cures.
It's so amazing how much we can learn by connecting the dots and looking at the bigger picture. It's like those crime dramas where they finally solve the case by putting together all those seemingly unrelated bits of info.
You got it. That's exactly what this registry allows researchers to do. It's a game changer for understanding and treating rare diseases, for sure.
Okay, on to a topic that's a bit more serious now. This next article examines Germany's new asylum laws and their potential impact on the health of refugees.
This is such a complex and sensitive issue, Stanley. Essentially, these new laws make it easier for Germany to deport asylum seekers, and they also limit their access to health care. Imagine fleeing a dangerous situation, seeking refuge in a new country, and then being met with all these bureaucratic hurdles and limited access to essential medical care.
That sounds unbelievably difficult. I can't even imagine the stress and the anxiety that would put on people who are already so vulnerable and facing so much uncertainty.
Yeah, it's a tough situation. And the article raises these serious concerns about the potential consequences of these policies on health equity. Refugees often face so many barriers to health care, even in the best of circumstances. And these new laws could make things even worse, push them further away from the care they desperately need.
It's a stark reminder that policy decisions have very real consequences. Speaking of consequences, our next article delves into the final verdict in the mediator drug scandal in France. This story has been making headlines for years now, hasn't it?
It has. And the final verdict is a huge moment. For those who may not be familiar with the case, the drug in question is called Mediator, and it was on the market in France for decades, prescribed for diabetes and weight loss. But over time, it became tragically clear that this drug had some truly devastating side effects.
I vaguely remember hearing about this. It was linked to some pretty serious heart problems.
Yeah.
And even deaths, right?
Sadly, yes. And what makes this whole case so disturbing is that the company that made Mediator, Servier, they knew about the risks, but they kept selling it anyway, prioritizing profits over the safety and well-being of their patients, and the consequences have been absolutely devastating.
It's a heartbreaking example of corporate greed, but at least justice was served right.
Yes, thankfully. The court found Servier guilty of manslaughter, aggravated deception, and a whole bunch of other charges. They have to pay millions of euros in fines, and some of their executives are even facing jail time.
It's a reminder that accountability matters.
Okay, let's shift gears and talk about a virus that affects millions of children worldwide. RSV, or respiratory syncytial virus. This study takes a deep dive into the global burden of RSV, particularly in premature infants.
RSV is a pretty common respiratory virus. Most children will get it at some point when they're young, and for most healthy kids, it causes mild, cold-like symptoms. But for premature infants, their lungs aren't fully developed, and their immune systems are weaker, which makes them much more vulnerable to serious complications.
It's so sad to think about these tiny babies struggling to breathe. The study mentioned that in 2019 alone, there were over 1.6 million cases of RSV in preterm infants worldwide.
I know it's a staggering number, and unfortunately, RSV is a leading cause of hospitalization and even death among infants, especially in developing countries.
So this study wasn't just about counting cases. It actually looked at what factors put these babies at higher risk.
Right.
They did. They dug deeper into the data to try and understand what makes some premature infants more vulnerable to those severe RSV complications. Things like underlying medical conditions, like congenital heart disease or chronic lung disease. They also looked at social and economic factors like poverty and limited access to health care, all of which contribute to the burden of RSV.
It's a good reminder that health isn't just about biology. It's also about those social and economic conditions. Okay, for a more uplifting story, let's head over to Ireland and look at their efforts to create a more equitable healthcare system.
Ireland is in the middle of this huge healthcare overhaul called Slintacare. It's really quite ambitious. Their goal is to make sure that everyone in Ireland has access to affordable, high-quality healthcare, regardless of their income or social status.
That sounds amazing. How are they trying to achieve something that big?
They're tackling the issue on a bunch of different fronts. One key strategy is reducing wait times for essential services, because no one should have to wait in pain or discomfort. They're also expanding the range of services that are offered for free, making healthcare more affordable. And they're trying to shift away from a system that relies so much on private insurance, which often creates those barriers for people with lower incomes.
So it's about creating a level playing field, making sure everyone has a fair shot at good health. Are they seeing any progress so far?
There are some encouraging signs. Wait times for certain procedures are starting to go down. More doctors are choosing to work exclusively in the public healthcare system, which is great. But healthcare reform is a marathon, not a sprint. It takes time, resources, and a serious commitment to see real change.
It's fascinating to watch, though, seeing both the challenges and the possibilities of building a truly equitable healthcare system. Okay, now let's step into a realm that's generating a bit of controversy. Gambling. This next article focuses on a white paper that was recently released by the UK government, outlining their new approach to gambling regulations, and it's stirring up a lot of opinions.
This white paper is a pretty big shift in the UK's stance on gambling. They're moving away from an economic model, where the focus was mainly on making money, and toward a public health approach that puts harm reduction and well-being first.
So it's less about maximizing profits from gambling and more about protecting people from the potential harms.
Exactly. The white paper lays out a bunch of measures aimed at reducing gambling-related harm, like stricter affordability checks to keep people from spending more than they can afford, tighter rules on advertising and marketing, and more funding for addiction treatment and support services. But there's one proposal in particular that is causing a lot of debate.
Okay, I'm all ears.
Well, they're suggesting using technology to track people's gambling habits and spending. The idea is to identify folks who might be at risk of developing a gambling problem, or who are already showing signs of addiction.
It sounds a little creepy, doesn't it, tracking people's behavior like that? Where do we draw the line between protecting people from harm and respecting their privacy and their autonomy?
That's the big ethical question. Critics argue that this kind of tracking is intrusive and that it raises all sorts of privacy concerns. They also say that focusing on individual behavior might take attention away from the problems within the gambling industry itself. Things like predatory marketing practices and the way some gambling products are designed to be addictive.
It's a tricky issue with no easy answers.
Mhm.
I think we're in uncharted territory as technology becomes more and more entwined with our lives. We need to have these tough conversations about where the boundaries are.
Totally agree. It's about finding the right balance,
Yeah.
using technology for good, but also safeguarding people's rights.
We're going to Russia, where the ongoing war has had a huge impact on the healthcare system.
This article is a pretty stark look at the state of healthcare in Russia, Stanley. A system that's been described as atrophying under the strain of war and years of neglect. It's a really worrisome situation, not just for the people in Russia, but for the whole world.
So what's happening on the ground? What's it like for everyday Russians who need medical care?
Imagine a healthcare system struggling to provide even basic care. Hospitals are understaffed, medical supplies are running low, and essential medications are becoming harder and harder to find. The conflict has pulled resources away from healthcare, making existing problems worse and creating new challenges. It's a perfect storm that's putting millions of people at risk.
I can't imagine the fear people must feel when they can't access the care they need. It's a reminder of the devastating human cost of conflict, how it affects not just those fighting, but the most vulnerable people in society.
And the consequences of this healthcare crisis go way beyond Russia's borders. A weakened healthcare system makes it harder to stop outbreaks of infectious diseases, which could easily spread to neighboring countries, or even globally. We live in a deeply interconnected world, and the health of one nation is tied to the health of all nations.
It's a sobering thought, one that highlights how urgently we need to find peaceful solutions and invest in strong healthcare systems that can withstand these kinds of challenges.
Well said, Stanley. Well said.
You know, from the challenges that healthcare systems face to the incredible individuals who dedicate their lives to medicine. This next article is actually an obituary for a true giant in the world of psychiatry, Peter McGuffin.
It's always a little bittersweet reading about these pioneers, isn't it?
Yeah.
They leave behind such an amazing legacy of knowledge. So what made Peter McGuffin stand out? McGuffin was a true visionary. Back in the 1970s when he was first starting out, the common belief in psychiatry was that mental illnesses were mostly caused by social and environmental things. But McGuffin had this incredible insight that genes played a critical role too. He was a pioneer in psychiatric genetics, long before it was a mainstream area of research.
So he's kind of going against the grain, huh?
Mhm.
Challenging the accepted norms.
Oh, absolutely. And he didn't just talk about it, he actually did the research. To prove it, he used what were called classical genetic markers back then, like blood types, to identify potential connections between genes and mental illnesses. And then when molecular genetics took off in the 80s, he jumped right on board, embracing these new technologies, really pushing the boundaries of what we knew about the genetic basis of conditions like schizophrenia and depression.
That's amazing. The science just explodes forward when you have these brilliant minds willing to question everything and explore new possibilities.
I know, it's so inspiring.
So what kind of impact did McGuffin's work have on psychiatry as a whole?
I mean, his research really revolutionized how we understand mental illness. He showed that conditions like schizophrenia, depression, bipolar disorder, they're not just psychological or social, they have a real biological basis too. And that understanding has opened up doors for new treatments and interventions, and given so much hope to people struggling with these conditions.
That's powerful stuff. It sounds like he wasn't just a researcher, but a real leader in the field too.
Oh yeah. One of the best parts of his story is that he didn't just focus on his own work. He built teams, fostered these international collaborations, and mentored so many up-and-coming scientists. His legacy goes way beyond just his publications. It lives on in the work of countless researchers and clinicians all around the world.
What an incredible guy.
Yeah. Let's start with a correspondence piece. It focuses on pandemic preparedness, so specifically global research funding. Making sure we're putting our resources in the right places.
That makes a lot of sense. I mean, the COVID-19 pandemic Really showed us where the cracks are in our global research system, right?
Exactly. We saw so much duplication of effort, funding gaps, and these huge disparities in research capacity between different countries. It was a mess.
It was.
So this article basically argues that we can't let that happen again. They highlight this new program called Pandemic PCT, which stands for Pandemic Preparedness, Analytical Capacity, and Funding Tracking.
Okay, so Pandemic PCT is like a global watchdog, keeping an eye on how research money is being spent, making sure it's going where it's needed most.
That's a great way to put it. They've actually developed this research funding tracking tool. It monitors how funding is being distributed across different research areas, different countries, making sure it aligns with global policy roadmaps.
So it's all about transparency and accountability. But is it just about tracking money? Or is there a bigger vision behind Pandemic PCT?
Oh, it's definitely more than just money. It's about fostering collaboration,
Yeah.
identifying where the gaps in our knowledge are, and making sure that all of our research efforts are focused on the most urgent global health priorities. They want to create this more coordinated and effective global research response, so we're better prepared for the next pandemic.
I love that. It's a good reminder that we're all in this together when it comes to infectious diseases. All right, for our last article, we're switching gears completely to the role of surgery in global cancer care.
This one's a correspondence piece, too. It offers a really interesting perspective on something that often gets overlooked when we talk about global health equity. They argue that while telehealth has amazing potential for improving access to cancer diagnosis and treatment, especially in those underserved areas, we can't forget about surgery.
That's a good point. We tend to focus so much on the diagnostic side, early detection imaging biopsies. But surgery is often a key part of treatment, too.
For sure. The authors point out that a huge majority of cancer patients, like around 80%, need at least one surgical intervention during their treatment. But access to timely and high-quality surgical care, that can be a real struggle. Especially in those low-resource settings, they might not have enough trained surgeons, or access to operating rooms, or the infrastructure to support those complex procedures.
So telehealth can help bridge some of the gaps, but it can't actually replace the hands of a skilled surgeon.
Nope, it can't.
What do they suggest we do about it?
They're calling for a more holistic approach, one that brings surgical care into those telehealth initiatives. Things like setting up clear referral pathways between telehealth providers and surgical centers, training more surgeons in those specialized techniques, and investing in infrastructure to support surgical services in those underserved areas.
It makes you realize that these complex health challenges need a multi-pronged approach. It's not just about technology. It's about building a whole system that works for everyone.
Couldn't agree more.
Okay, our final article in this deep dive takes us to Nepal, where healthcare workers are facing a pretty scary problem: violence. This article is a call to action, urging the government there to do more to protect the people on the front lines of care.
It's a really disturbing trend, and it's not just happening in Nepal, unfortunately. Healthcare workers all over the world are facing more and more verbal abuse threats and even physical violence. It undermines the entire healthcare system.
It's hard to imagine why anyone would lash out at the very people trying to help them.
I know, right?
What's causing this?
The article digs into a few different factors. Sometimes it might be a lack of understanding about what healthcare can and can't do. Patients or their families might have these really high expectations. And when those aren't met, the frustration and anger can turn into aggression.
So they're taking it out on the messenger, basically.
Exactly. And then sometimes it reflects bigger problems in society, like a lack of respect for authority, or a culture where people think they can get away with violence. Regardless of the reason, the consequences are serious.
Yeah, this isn't just about hurt feelings.
Right.
This violence has a real ripple effect on the whole system.
Absolutely. It creates this hostile work environment, leads to burnout among healthcare professionals, staff shortages, and ultimately worse care for everyone. It even discourages people from going into healthcare in the first place, which just makes the workforce problems even worse.
It's a vicious cycle for sure.
It really is.
So what needs to be done?
The article calls for a multi-pronged approach. They say this isn't just a healthcare issue, it's a societal issue, so it needs a bigger response. Things like stronger laws to protect healthcare workers, public awareness campaigns to educate people, and a zero-tolerance policy for violence in healthcare settings. It's about creating a safe and respectful space for the people who dedicate their lives to caring for others.
Well said.
Well, that brings us to the end of our deep dive into this issue of The Lancet.
It's been a whirlwind of cutting-edge research and really thought-provoking discussions about the state of global health.
As always, I've really enjoyed our deep dive. It's so inspiring to see the power of knowledge and the dedication of these researchers and clinicians.
And to all of our listeners out there, I hope this deep dive has sparked some new ideas and left you feeling inspired to learn more.
Don't forget to check out the links to all the articles we discussed in the description. Go explore those topics further and keep those brains engaged.
Until next time, stay curious, stay informed, and stay healthy.